Today's topic is anemia. Classification of anemia according to underlying mechanism. Welcome Medicos. Let's begin with this quote. Dreams are meant to be lived, so stay awake. So we have this classification on the basis of mechanism given in Robbins. So we will be seeing a mnemonic for this particular thing. So on the basis of mechanism, we have three classification. Anemia can be due to blood loss. Anemia can be due to increased red cell destruction or hemolysis. Anemia can be due to decreased red cell production. Blood loss can be acute blood loss or chronic blood loss. In acute, the condition like trauma can be there, where the blood loss is severe, leading to anemia, or chronic blood loss, for example, in GIT lesions or gynecologic disturbances. For example, anemia secondary to hemorrhoids. Coming to the mnemonic for increased red cell destruction, so we have the mnemonic male Tisha, MAILTISHA. So this is the mnemonic. We'll come to it again. So M stands for mechanical trauma, A stands for antibody mediated destruction, I stand for infection of red cell, L stands for membrane lipid abnormality, T is toxic or chemical injury, I is inherited genetic defect, S is sequestration, H is hemoglobin abnormality, and A is acquired genetic defect. For decreased red cell production, we have this mnemonic INS guides. This is the mnemonic and the meaning for each word. We'll come to it again. N is neoplasm, primary hematopoietic neoplasms. I stand for infection of primary progenitor cells. S, sequestration. It is actually inflammatory mediated iron sequestration. G is membrane lipid abnormality. U is for unknown mechanism. I is immune mediated injury to progenitors. D is deficiency, nutritional deficiency. E is erythropoietin deficiency, and S is space occupying marrow lesions. Now let's revise. So for increased red cell destruction, we have this mnemonic male Tisha. M is for mechanical trauma, for example in DIC and when a person is having defected valves. So due to the trauma, the RBC get lysed. From A, we have antibody mediated destruction, for example in RH incompatibility or in transfusion reactions. I, we are having infection of red cell, for example in malaria, there is increased destruction of red blood cells and babesiosis. L is membrane lipid abnormality, and example is like A beta lipoproteinemia. T is toxic or chemical injury, for example due to snake venom or lead poisoning. I is inherited genetic defect, and which can be either red cell membrane disorder or enzyme deficiency. In red cell membrane disorder, we have hereditary spherocytosis and hereditary elliptocytosis. In enzyme deficiency, we have either glycolytic enzyme deficiency or we have deficiency in HMP shunt pathway. In glycolytic enzyme pathway, we are having two main enzymes, hexokinase and pyruvate kinase, and in HMP shunt, we are having G6PD deficiency. S is for sequestration, and it will be seen in hypersplenism. H is for hemoglobin abnormality, for example in thalassemia where there is a defect in globin synthesis, or sickle cell disease in which we see structurally the abnormal globin synthesis. A is acquired genetic defect, for example in PNH, paroxysmal nocturnal hemoglobinuria. Coming back to decreased red cell production, the mnemonic was NIS guides. N is primary hematopoietic neoplasm, for example, acquired leukemia, myelodysplastic syndrome, and myeloproliferative neoplasms. I stands for infection of primary progenitor cells, hence there will be decreased in red cell production, for example, parvovirus B19 infection. S stands for sequestration in male Tisha also and in NIS guide. The first S, sequestration. Inflammatory mediated iron sequestration. This is anemia of chronic inflammation. G. Inherited genetic disorder, for example, in Fanconi anemia and thalassemia syndromes. U for unknown mechanism, like in endocrine disorders and hepatocellular liver disease, we see there is a decreased red cell production. I is immunity mediated injury to progenitors. Again, if progenitors are injured, then there will be a decrease in production of RBC. This we see in aplastic anemia and pure red cell aplasia. D is nutritional deficiency. For example, iron deficiency or vitamin B12 deficiency or folate deficiency. In iron deficiency, we see microcytic anemia, and vitamin B12 and folate deficiency, we see macrocytic anemia. E is erythropoietin deficiency. This is seen in renal failure and anemia of chronic inflammation. S is space occupying marrow lesions. The examples are metastatic neoplasm and granulomatous disease. We'll get back to you soon to leave you with this thought. To live your dreams, you have to be awake. Thank you.